Okay, that was actually a good introduction, because the first thing I was going to talk about was the exposure approaches that we're taking towards exposure in our epidemiologic study. Within the survey, we're collecting address information. Although if somebody does not want to give us the address, we recognize that, you know, some people don't want to, and some people probably shouldn't, wanting to be able to make it inviting for undocumented people to also complete the survey. So we gave them the option of saying, here's an intersection that is within a 5 to 10 minute walk of my home, which in most areas would be very much not identifying. And that address data is what we are hoping to use to then be able to assign exposures using some of the methods that Colleen just described, which a number of air modelers at UC Davis have been involved in a current effort that, and you might be involved in it too as well, Colleen, I'm not sure, but it's taking modeling some of the data that's collected using the aerial optical density as well as the ground monitors, and there's ground monitors from many, many different agencies that monitor in California, including CARB, the Air Quality Management Districts, CAL FIRE, sorry, not CAL FIRE, the U.S. Forest Service, and so taking what's on the ground, what's up looking down on the plumes, and using the advantages of you know, the satellites don't have complete temporal resolution because they're circling, whereas the ground monitors have, you know, all time points, but they don't have the spatial coverage that the aerial optical density ones do, and of course they are measuring different things. So a number of groups are trying to figure out how to really integrate and validate measurements against the various models. So we're waiting for some of those models to get ready for prime time, and then we'll link those to the address data. So that's one of the things we've been thinking about. We're also using, for the moment, evacuation versus not evacuation. That's, you know, it's a measure of the closeness to fires as well as stress, although we did discover that there are some people who are really close to the fires, like what was I think our smallest group was within from a block to, well, a block to, Katie remembers what it is. 3 blocks, 1 to 3 blocks or something like that. Okay, and there are some of the people, as they said, the fire came within 1 to 3 blocks of their home and they did not evacuate. So we're wondering about the mental health of some of those people, or their physical ability to actually get out as well could be part of that. So we have evacuation, we have proximity to the perimeters of the fires, distances, you know, interestingly, some of our results do differ a lot by evacuation status or not, more on the mental health side than the respiratory. And you can think about the respiratory as being some people who evacuated ended up staying somewhere very far from the fires. And some people who didn't evacuate, you know, may have still gotten a lot of smoke exposure. So that could have blurred exposures. So that's one approach towards exposure. And then a couple of other things we have been doing, and I have some slides that I'm going to skip over to get to those, about measuring ash samples and air. So I started talking to some of these air quality people at UC Davis, and they said, well, you know, while the fires were going, I said, can we get in there and get some samples to, you know, fill in really right on the spot where the fires are, to the extent that the monitoring networks don't reach some of these areas. And I was told, well, the problem is, you know, we need a power source. And, you know, where there's been a lot of fire and destruction, first of all, the grid, you know, by then it was off. So a couple of them got together and they, okay, yes, so for air quality, so Tony Wexler and Keith Bine said, we're going to see what we can do to come up with some sort of a mobile air sampler. And I think the next slide shows this. So what they did was they got a couple of smart cars that they were able to get on the cheap, and reconfigured the batteries to actually run a sampler. And so they built 2 of these little smart car based samplers. And I mean, it took many, many months. You know, the fires had come and gone. And then we were in 2018, and they said, okay, you know, let's see if we can get up to Butte County. And so they have a flatbed truck that they mounted these 2 little smart cars on and drove up there. And Keith Bine, one of the people working on this, actually had gone to Cal State Chico. He had some friends there and thought, you know, with his friends, they'd be able to get into the fire area, but no dice. So, and they tried, they begged, they said, look, you know, this is for science and so forth. And Cal Fire said, no way, we're gonna let you in. So we're still working on that problem. And I know Kat has given us a couple of pointers on that. The other was the ash sampling. And so Tom Young had a graduate student who was from Santa Rosa and collected about 18 ash samples from homes that had been destroyed. 15 were from homes that had been destroyed, and 3 were from the Robert Wood Stevenson Park, which, let's see, does this have a point? Oops, oh, that doesn't really work, does it? Okay. Anyway, it's where the green is above the tub fire. RLS is Robert Louis Stevenson Park. So they got 3 samples there. So that's just vegetation, not housing materials. And they've been comparing the chemicals that they're detecting using a non-targeted analysis in which they're literally getting thousands of peaks representing different chemicals, many unknown. And this is these are Venn diagrams. And so just looking at the one on the left, we see Robert Louis Stevenson, you know, had about, that were only had about 606 entities, different chemicals, and in that tan circle. So there's 600. There's a 1 that's in all 3 of these, and then 5. And so the blue is the blank, and then the red is the homes. And so that's got about 1,947 that are not in either the blanks or in the Robert Louis Stevenson Park. So 600 overlap between them. So that's a lot of chemicals that are unique to our, you know, built environment. The furnishings we have in our homes, the materials, the building materials themselves, including, you know, wall board and particle board and all of the glues and solvents that goes into these synthetic building materials. They're working on trying to figure out a strategy to identify ones that might be important toxicologically. So we've had a lot of discussions about how to do that. So those are a couple of exposure challenges. We're also collecting in the pregnancies cohort study, we've been collecting biological specimens of the women, hair and urine and blood, and I forgot what else. I think they're getting toenails. And then for our survey, now that we've actually gone statewide with our survey, and it's adaptable now for every fire. I mean, it'll just be up there for any fire in California. And we're with this one, we're asking people to, you know, answer yes, no. One of the questions is, would you be willing to donate to have a blood sample or a hair sample? So we'll be collecting some samples. And the nice thing about hair is that, you know, it grows such that we can go in now at this point in time, and we'll be able to see whether, if you take out a hair, if you cut your hair now, you've got time from before the fire and after the fire if it's long enough, right? So if people will be collecting hair samples, and we may actually see a sort of break point from when those fires came out, occurred in certain chemicals that may have been released because of the fire. So the hair samples is something I think is kind of cool because you can get that time course. Unlike in blood, you're just getting really cross-sectional data, depending on the half-life of the chemicals, of course. So those are a couple of our exposure things. And then, how much time do I have? 5 minutes. Okay, so I'm going to go back because I just had some sort of thoughts about advice to individuals, and this is just based on kind of reading and talking to people. But some of these things may be easier than others to achieve that people can do. The staying indoors. But if the fire goes on for weeks and weeks, and you've got some preschoolers, and you're going to try and keep them indoors for weeks at a time, which is what's been happening not just in California and Washington State. They've been having these long-lasting fire periods now in the summer. They're mostly forest fires, not urban fires, but the smoke is really penetrating into big urban areas. And then these are some thoughts about communities, how communities can prepare. Some of these were talked about this morning, clean air spaces, and somebody mentioned upgraded filtration systems, so I updated my slide to include that for schools and such. Improving our infrastructure for sanitation and water and food. I didn't mention that we've had a couple of people go out and collecting homegrown garden produce in Sonoma County, and that group came out with actually a report of what they measured in lettuce samples and a few other products, kale, I think, and I can't remember what else. So there was a lot of concern about food contamination for locally grown produce, and there's a lot of agriculture in some of these counties with fires. So yeah, identifying isolated individuals who tend to be some of the people at the highest risk. And then we are building more and more in that wildland-urban interface, the WUIs, and what we might consider is restricting and zoning regulations to discourage growth in those areas. Some kinds of, or incentives to, disincentives for that. And then I was talking earlier about mental health providers. I think that's an important one. And then these are some of the questions that I think, there's many questions, but these are some areas of where needed research. Wait a second, I've got the wrong thing here. This looks like, shoot. It looks like I didn't save the last, Okay, and I had another slide which was policy suggestions too, but apparently I either saved the wrong thing or sent the wrong thing to be up there. Anyway, so I'll stop here. I have 3 more minutes, but I'm not going to ramble for no reason unless I had something else here. This was about the exposures, and then we talked about these things. So, yes, okay. This is just an amazing picture from the campfire that I actually did want to show, which is that this is at noon, approximately, and that fire the plume just took over the whole sky. And then what was interesting was that there was a meteorologic inversion, which brought this plume all the way down to the Sacramento area, and that was like, that's 90 miles, and we were having 90 miles away. We were having these, air quality indices that were over 400. So, very, very scary. And I do want to end. Actually, this is something I did want to do, which is talking about wildfires and climate. And I think this is. I know there are some people who work for agencies where they're actually not allowed to say that. Under the current administration, but since I work for an academic institution, I am going to emphasize that we can't separate out these, the health effects that we're getting from the consequences of wildfire, and that we need to be thinking not only about protecting our health in the immediate, but also about the mitigation of our changing climate and global warming, which was mentioned again this morning. So I just want to emphasize that. This is a really interesting paper that came out that the Lancet published on safeguarding human health. And it's not just climate. They're talking about globalization and mass extinctions that we're causing through various other activities as well. And then this is the World Health Organization's recent report, COP24, in which they really highlight that climate and health are not yet linked in the public mind, and that's really a big task for all of us to make that known and widely accepted, and making that part of the culture. So that's really the last thing.